My name is Judy Kihumba. I am a sign language interpreter and also an advocate for maternal and mental wellness of deaf women. I am a mother. My passion being in the deaf world started a while back when I was in high school. I went to Reverend Muhoro School for the Deaf, where I schooled with deaf people. I learned sign language and I made part of my friends, I would say 90% of my friends are deaf people. So that's where I made friends and I walked through their journey, I learned their language. In 2020, when COVID happened, I gave birth to my very beautiful girl. And through then I went through postpartum depression. Again, most of the people who would come to check on me were deaf people. So again, now I found myself thinking about them more because of what I was going through. So I wanted to know, what do they know about it? Would they be knowing, and maybe they sometimes go through them and they don't know what it is. So that's how I found myself founding the organization Talking Hands, Listening Eyes on Postpartum Depression. Hello, my name is Rachel Waithera, and this is my sign name. I live in Dagoretti here. I work at Dagoretti Special School. I was a teacher there before, but now I have changed to focus on caregiving of children with disabilities, different disabilities, autism, mental, or disabilities. I take care of them. As a deaf mother, there are very many struggles, but I would say, let me start from the hospital, the challenges in the hospital first. Most of the times in the hospitals, there are communication barriers, and because most of the public hospitals don't have sign language interpreters, sometimes you find yourself alone. Sometimes it's stressing because you don't get enough information, and sometimes the doctors think they know sign language and sometimes they don't communicate the right way. Most of the deaf people, if you count out of 5, 4 have lost pregnancies. They have lost either because they went to the hospital and the doctors didn't do thorough checkup on them, gave them the wrong medication, and they miscarried. Many of them would tell me that. So that's when I started to be keen about the health care of deaf women and more so on the pregnancy journey. For me, I stayed in the hospital for 2 months and it was a lot of struggle. I really got different challenges. Sometimes I would even cry out of frustration because the communication was really hard, because I was always last to get information. Sometimes the doctor would come and talk to the people on how talk to the mothers on how to take care of the babies. I'm just there seated. I don't know what they are saying. Sometimes they plan programs on how to give jabs to the kids, and sometimes it was hard for me to know when and when to be ready. Now again at home, when the baby cries and I stay alone, I don't know how long the baby has cried, because sometimes I may be asleep and the baby has cried for so long. Sometimes I just panic. Oh my goodness, my baby has been crying for that long. I don't know how long in the house. Sometimes especially when we are asleep, it's really a struggle for me. I think I've worked with more than about 100 deaf women different ways, because there are those who have already given birth, and those I have worked with the journey from conception to giving birth.
I think maternal health is something that people really are not aware of, and I would say it's a virgin area, quote unquote. It's something that we are rediscovering as Kenyans or African as a society. So most of the time you find that there's a gap and a lot of women go undiagnosed when it comes to maternal health or don't understand. Then also women there is stigma, or there's a myth whereby if a woman is pregnant, she's supposed to be dramatic. If a woman, is from giving birth, she's supposed to be having mood swings. So at times you find that people miss out on that because of social norms or the culture that we perceive of women.
There is a big problem because sometimes the government know they're deaf women. They know the women with disabilities have a right to be communicated to especially getting sign language interpreters in the hospitals, or train the doctors to know sign language, so that even as they work in the government hospitals, it's very easy to communicate with the deaf, because that's the only way. Because most of the times we feel like we are oppressed.
We have not sensitized people enough. Also, I think it's lack of civic education from us now as professionals, and also people who are supposed to be doing that as psychologists. We've not done enough advocacy, because even when you see online webinars, events, hardly do you see, you know, maternal health for women with disability or mental health for people with disability.